This audio tonight obtained by CBS News. It's fairly incredible. Just listen to this.
Do you have any system in place that you feel can adequately identify cases and isolate them and contact trace them, or are the capabilities and resources there that that's not something that you can do given with what you have?
Yes, Dr. Fauci, we are trying to do contact tracing, but literally we are one day away if we don't get test kits from the CDC that we wouldn't be able to be tested in Montana. We have gone time and time again to the private side of this, the private market, and where the private market is telling us is that it's the national resources that are then taking our orders apart. Basically, so we're getting our orders canceled. That's for PPE, that's for testing supplies, that's for testing equipment. So while we're trying to do all the contact tracing, we don't have adequate tests to necessarily do it. We don't have the PPE along the way, and we're not finding markets to be able to do that along the way, or private suppliers. So we do have to rely on a national chain of distribution, or we're not going to get it. But we are doing our best to try to do exactly that. In, like, Gallatin County would be an example where we have almost half of our overall states, those are the positives. So we're trying to shift the supplies to really isolate that and do the contact tracing, but we just don't have enough supplies to do the testing.
Tony, you can answer it if you want, but I haven't heard about testing in weeks. We've tested more now than any nation in the world. We've got these great tests, and we come out with another one tomorrow where it's, almost instantaneous testing. But I haven't heard about testing being a problem.
I haven't heard about testing being a problem, the president says. You just heard about testing being a problem. That's what you're responding to. Somebody telling you that testing is a problem. I haven't heard about testing being a problem. Testing kits are among the critical medical supplies that governors around the country cannot source on their own to cobble together a 50-part symphonic response to what is the worst national crisis on the globe when it comes to this virus. 50 governors doing their best, trying to cobble together access to testing, access to masks, access to gloves, access to ventilators. 50 governors trying to do it, and the president saying, I haven't heard this is a problem. I'll back you up if you need it. Make sure you say nice things about me. I mean, that's the status of the national response to this crisis right now. We have the biggest and worst coronavirus epidemic in the world, and it is slated to get way worse than it is right now. They want to call this the Chinese virus? China had half the number of cases that we've already got. And you see the way all of our curves are going right now. In 50 states, in all of our biggest cities, and lots of places that aren't big cities at all. Our national response to this crisis has been this kind of useless. There is no nationalization of critical medical supplies. There's a lot of happy talk about how much we have, and then you hear from the nurses and the doctors and the people in the front lines who are actually seeing patients saying, we don't have it. We're being told to use the same mask every day. This is the kind of useless national response that is going to result in the deaths of thousands and thousands and thousands of Americans. But this is the federal government that we've got. And so we look elsewhere. It turns out there are other people who maybe have some better ideas about how to pursue these things. And maybe there's some chance of those ideas getting through despite the ongoing nonsense and the disastrous, fatal lack of leadership at the top of the U.S. federal government.